Hi, I'm Allie Cook for the Dental News Network. Today is June 6th, 2012, and this is your Wednesday Watch. Here are today's top stories. A woman in the United Kingdom has been left toothless after a botched implant procedure. Worse, her dentist relocated to Poland, leaving her with few options to fix this $1,000 mistake. The dentist's license to practice has been suspended by the General Dental Council, quote, for protection of the public and in the public interest. Unfortunately, due to his indemnity status, this wronged patient is unlikely to be compensated. She is part of a group calling for immediate change to laws which can leave patients powerless if dentists have no insurance, move abroad, or refuse to contact their insurers. Sleep apnea is now linked to cancer. 2 new studies have found that people with sleep apnea have a higher risk of developing cancer. Researchers in Spain studied thousands of sleep clinic patients and found that those with the most severe forms of sleep apnea had a 65% greater risk of developing cancer of any kind. The second study of about 1,500 government workers in Wisconsin showed that those with the most breathing abnormalities at night had 5 times the rate of dying from cancer as people without the sleep disorder. Both research teams only looked at cancer diagnoses and outcomes in general, without focusing on any specific type of cancer. Coming up, products and procedures, but first, please watch this brief message.
Hello, I'm Dentistry Today.
And I'm a different dental publication. You know, we use a lot of the same kind of articles.
Like clinical articles?
Yeah, but we cover a lot of things that keep us.
You should see this guy do a case study.
Oh, stuff.
Yeah, he knows I'm better at dental publication stuff like buyer's guides, diagnosis and treatment, continuing education, stuff like that.
Oh, what exactly do you mean by better?
By better, I mean getting a top clinician to write an article is easier for me than it is, well, for you.
Oh, that kind of better. I was thinking of another kind.
What other kind?
And now, products and procedures. New research indicates that wisdom tooth removal patients heal faster without stitches. A Nigerian research team completed a study involving 80 patients between the ages of 18 and 38 and divided them into 2 groups. One was given sutures after wisdom tooth removal and the other was not. The group that did not have stitches reported less pain and swelling during the first 24 to 48 hours and also reported being able to open and close their mouths more easily. Dentistry Today's June issue has just come out, and today we have a special guest to speak about his article. Here is cover author Dr. Gregori Kutzman to talk about his article in this issue.
Join us in the upcoming issue of Dentistry Today, where we'll be discussing harmonizing the white and pink, where we'll look at a case where we're trimming the gum tissue to eliminate a gummy smile using bipolar electrosurgery, and lengthening the incisal edges to replace worn incisals using direct composites, so we can get a more aesthetic smile and frame the picture a lot better when we harmonize the pink with the white.
Thanks, Dr. Kutzman. And thank you for checking out the Wednesday Watch. We'll see you next week with more from Dentistry Today and DNN.